It is a year like no other, almost 4 months since we reported the first case of COVID-19 in the country.
The confirmed case arrived in the Philippines from Wuhan, China.
Infections have significantly increased here and in many parts of the world. Most everyone was told to stay home, to stay safe. National and local government officials took sweeping action to try to stop the spread of the coronavirus.
We are inclined to extend the lockdown up to April 30. Tignan natin after that.
While mandatory quarantines and lockdowns are still in place, experts say what matters most is testing, testing, testing.
Just in the past few days, we increased our testing, our actual testing per day by 50%. Now, are we happy with that? We're not. The goal is by May 15, we will have a capacity of about 15,000 tests per day, and by May 30, a capacity of 30,000 tests per day.
How much progress are we making in identifying and isolating clusters and cases?
Ultimately, we want to be in containment phase, and that means basically trying to put a box around the virus and contain it. In order to do that, you got to find people who are infected right away.
Where are we now? And where do we go from here? This is a CNN Philippines special presentation, Just the Facts, from response to recovery. The promised capacity of more than 60 testing facilities in the country was 50,000 a day, but the numbers tell a different story. Actual testing is just at 1/5 of total capacity. What's going on? Just weeks ago, the palace spokesman, Harry Roque, announced testing capacity had reached over 32,000, only to be corrected by the health department, saying the number stands at only 8,000 to 10,000 tests. And there was that fiasco over terminology. Is it mass testing, which implies that every last person of our 110 million population would be tested? Or is it expanded or targeted testing? They really mean to say that only those with COVID symptoms would be tested given limited supply. Again, the question, what's going on? Good evening. I'm Pia Hontiveros. Let's begin by getting the numbers down first. We know that testing plays a key role in responding to the COVID-19 pandemic. Joining us live is our Carolyn Bonkin. She's been our designated correspondent at the Health Department since the beginning of the year. Now, Carolyn, how many testing facilities do we have now, and what do we know about their capacity on a daily basis?
Well, we have seen a significant increase in the number of laboratories in the country, especially in the past weeks. In February, we only had one government laboratory for COVID testing, which is the RITM. At that time, we still had to send specimens to Australia, but today we can do it all here. In total, we have 62 testing facilities for COVID-19. It's a result of the coordination among different sectors. These are 29 privately owned and 33 government facilities. Some modular laboratories have also been donated to the government. The labs are a combination of RT-PCR and gene expert laboratories, which should be able to run a batch of specimen within 45 minutes to 4 hours. Back to you.
So, Carolyn, ideally, how much should their total yield be every single day?
So based on the number of machines, resources, and operating hours, these laboratories should be able to do at least 50,000 tests daily. But in reality, we're still far from that number. Officials say there are still a number of factors getting in the way. The biggest challenge today is to increase the actual number of tests that these labs will do on a daily basis. The highest number of tests performed in a single day was on Wednesday, June 17. 56 laboratories were able to process almost 16,000 samples. That's actually 15,954 to be exact. But days before that, the actual test averaged at around 10 to 11,000 daily. So malaki pa talaga yung hahabulin.
Yeah. Carolyn, sometime in May, sinabi na nga ni Secretary Harry Roque, na 32,000 testing capacity na, no? But why are we unable to meet the 20,000 or more milestone a day?
Well, when you talk to people on the ground, when you read comments on social media, this is also what many have been asking. Why are we not maximizing the laboratory's capacity? Why are we not testing more on a daily basis? In the past 2 months, officials have been explaining that this is mainly due to lack of supply. There's still an international supply shortage. So you can have a machine that can do 300 tests, but if you're short on reagents, for example, then the lab will not be as productive as it should be. There are also operational limitations. So in the past weeks, a number of laboratories either suspended or scaled down operations when a staff got sick or due to technical issues. A few weeks ago, the backlog increased when the exhaust system of a laboratory in Visayas was broken. Given that live virus are examined in these laboratories, every part of the facility should be working properly to make sure that the staff is safe. Sabi nga niya, spokesperson na Rosette Vergere, hindi naman daw mawawala yung ganyang mga operational issues.
Yeah, as in any and all laboratories. But Caroline, so bakit nga ba ganyan? No? Let's focus on halimbawa yung supply. Kulang ba yung supply? Is it because well, all countries around the world need that supply, no, for all these testing labs. And bakit, no? Is it also because, or is this a matter of kulang ang pagkumpas sa response to the COVID-19 pandemic?
Well, yes, Pia, definitely. Malaking hadlang dyan yung global supply, especially almost all countries are in need of test kits, reagents, and other laboratory supplies for COVID testing. But of course, there are also issues about health officials allegedly favoring a supplier or purchasing overpriced test kits. These have been the subject of congressional probe and now even the Ombudsman's investigations. A number of times, the Health Secretary has been asked to resign over this and his supposed inefficiency and delayed response. But until now, he enjoys the confidence of the President and his DOH staff. But aside from health officials, we also have people from the private sector helping. Vince Dizon of the BCDA was tapped to be the testing czar. He helped coordinate private and public sector groups to build more laboratories. He said, our bulk order from abroad will arrive this week. It should be enough for 1 million tests. Other private individuals and organizations also donated machines and offered help in testing. So the goal is actually to have 100 laboratories and to test 1.5 million people by end of July. Yeah.
Well, that's true. No, private sector, a very big contribution to this testing effort. Caroline Bonkin there reporting. Joining us this time is our very own Dr. Freddy Gomez. Now that we know what we know, what are the implications if we do not test or cannot test enough people in our country? The World Health Organization said 1 to 2% of our population would be an ideal number. Doc Freddy, please help enlighten us.
Yes, hello, Pia, and hello to all those watching. You're exactly correct here with those numbers because widespread testing of most of or even the entire population would help identify so-called hidden carriers or pre-symptomatic individuals. And those are the ones infected with COVID-19 but who show no symptoms of it. And according to the latest research, these individuals play an important role in the spread of COVID-19. Identifying these silent spreaders, so to speak, could help public health workers be more effective at contact tracing by identifying others who have been exposed and may require quarantine. So to answer your question, Pia, the lack of widespread testing could render us blind to the unknown spread of the virus and possible deaths that may follow. Pia?
Yeah, Freddie, let's talk more about the importance of testing as a reminder to our audience. Why is it so crucial and critical to us? But the government says test, trace, and treat, no? Why is testing so important?
That's right. So in addition to what I have said earlier, ultimately, we want to be in containment phase. And in order to do that, you have to find the people who are infected. They need to be isolated and their contacts need to be traced. The key to doing that is testing. Widespread testing would also help identify areas which pose greater risk. Testing and tracing, that's how we'll prevent or limit future surges. Yeah?
If we can't test, we can't trace. If we can't trace, we can't treat. But Doc Freddy, the guidelines as of this moment is not everybody is tested, no? Kung may symptoms lang, kung meron kang exposure to a COVID positive case, right? At the moment, ganon. Hindi po ba?
That's right, Pia, and that's mainly because of the limitations of just the amount of test kits that we have. But in an ideal setting, what we want is to be able to test anyone who wants to be tested, or actually, as much as possible, everyone to be tested, because that would give us a greater picture, a bird's eye view, basically, of where this virus is and who's being infected, how it's moving.
All right. Thank you, Dr. Freddy Gomez. We'll see you again later on in the program. We want to show our audience what happens at testing laboratories in the country. And I know you were at one today, and that would be very interesting. So we have 60 plus testing facilities, as Carolyn Bonkin said earlier, and we know we need to do more. And clearly, there are quite a few hurdles. We're joined now by Dr. Januario Bill Veloso. He is the head of the UP-PGH Central Laboratory, a DOH-accredited COVID-19 testing facility. Dr. Veloso, good evening. Thank you very much for joining us now.
Hi, good evening. I'm glad to be here. First of all, I'm the head. Yeah, I'm the head of the UP-PGH molecular laboratory, not the central laboratory, if that's what I heard.
I'm sorry.
So just to make that clear. Okay.
Thank you for that correction.
Yeah.
Yes, okay.
Yeah,
We're going to edit that right now so that when I say thank you to you later, we will say UP-PGH Molecular Laboratory. Dr. Veloso, tell us first,
right.
It's interesting, when Carolyn reminded us earlier, in February when this all began, we had one testing lab. Today, we have 62. I mean, it's such a relief not to know that. But yung UP-PGH, can you tell us how you built up your testing capacity? What challenges did you go through? How I'm sure it was very challenging and very difficult.
Oh, yes, absolutely. The first challenge is always, the start is the physical facility, because we have to build a BSL-2 type of laboratory with air handling. So because we're dealing with a highly infectious organism, so the air handling is very crucial. So that alone will take a few weeks if we can rush it to build. So fortunately, we have such a facility in PGH. So we retrofitted it for COVID-19 or SARS-CoV-2 testing. So that did take a while, but we did it. Then the second challenge is to buy the equipment. We only had one PCR machine. That's not enough for a hospital like PGH, which was designated a COVID-19 referral center. And it takes a lot of money to do that, to buy all these machines, to build up capacity. So fortunately, we were given a grant by the Lopez Group of Companies. And with this, we were able to build up our machines. We now actually have four PCR machines, including one fully automated machine. And we actually have 5 DNA extractor machines. But unfortunately, like mentioned earlier, if you don't have the reagents for the machine, for the extraction machines, you can't operate them. So that's a problem now. We only have 2 operational extraction machines. So we still have to do a lot of manual extraction. So it takes a lot of time and manpower to do manual extraction. But from the start, from 80 samples per day, we went up to 150, and finally now we're up to 500. But we can't go beyond that until we get reagents for those extraction machines I was talking about. So until we get those reagents, we can't reach our goal of 1,500 tests a day.
All right. This is exactly what we were talking about with Carolyn Bonkin. All these little challenges that each of these labs have. And that's why, people wonder, why can't we do more? No, why aren't the labs churning out more results? Why aren't they coming in faster? And that's precisely because of these many challenges along the way. And for example, like machines break down every so often. Like you said, reagents, kulang, and then you had to depend on the private sector. No, so these are all things that need to be taken into consideration when people ask, why are we having such a difficult time when it comes to testing. Is that accurate, Dr. Veloso?
Yes. There's also, yeah, it's highly accurate. There's another factor, manpower. Um, PCR it's not an easy test to perform. It's very complex and it has a lot of steps. So if you're automated as much as possible, it eases the burden. But still, in order to do PCR, I'm willing to bet no lab does 24/7 operation at the moment. But most
Okay.
labs probably do an extended shift, which is a 12-hour shift, one 12-hour shift per day. So if because of lack of manpower,
Mhm.
if we had the manpower to man the
Yeah, but
laboratories for
12 hours.
24/7, then you could double or triple the capacity of the lab. So if I'm in my lab, we're doing 500. If we could do and one more shift, we had the manpower to do it, then I could go up to 1,000. So if all labs could do that, then you just double the capacity, the present capacity right now. So that's another factor in building up test volume is the manpower
Yeah.
that's needed to do it. And
Oh,
right
pero
now,
mahirap nga, no? Kung if you have
manpower is
people
in
working on 12, yeah. Yeah. Oh,
yeah, we
well,
have
yeah, that's
people
a little bit
working on
difficult when
12-hour
you have people on
shifts.
12-hour shifts, no? Ang hirap
Hmm.
nun. But
Yeah.
Dr. Veloso, one last question na lang, no? How fast can you get results out?
Okay. At the PGH, we prioritize. We give priority to samples. But let's say ordinarily or routinely rather, we can get out a result in 24 to 48 hours. That's routine. All tests that we do, as soon as we do it, we can get it out in 1 to 2 days. But for urgent or priority cases needing immediate treatment or intervention, I'll give you a specific example. Maybe a woman comes in pregnant and you need to deliver her and you need to know the COVID status. So you want to get the test result out right away. We give out the test results in 12 hours. We can do that the same day. So the test,
Mhm.
we start the test in the morning. We can get out the result late afternoon for that particular patient. So we in PGH we prioritize our patients as well. So we give a certain segment of the population we have to go to get the results out in the same day, and we can do that.
Okay. Well, 12 hours. Well, hopefully the labor lasts for 12 hours kung ganon ba. Anyway, Dr. Bill
Yeah.
Veloso, coordinating head of UPPGH Molecular Laboratory. Thank you very much for being with us tonight. And well, speaking a
Thank you
while
very
ago,
much
Dr.
for
Veloso
having.
was talking about how the private sector helped so much in the UPPGH Molecular Laboratory. Well, speaking, like I said, of the private sector, many in the private sector helping support the government's efforts to ramp up our testing capacity. And one of them is Joey Concepcion, who leads Project ARC. He's also presidential advisor on entrepreneurship and Go Negosyo founder. Secretary Sec Joey, thank you very much for joining us. Good evening.
Good evening, Pia.
Yes. Well, Sec Joey, let's begin with this. No, let's as briefly as possible, if you can, no, tell us that long story about how you put up Project ARC. And ARC means it means anti-rapid test kit, right? And then you also use that term because does it have any biblical references or something? Tell us that story lang po, sir.
Well, ARC it stands for Antibody Rapid Test Kits, though, and it's of course the biblical of Noah's Ark, saving the people from all of that. So he brought in the animals and the people, and so that's the biblical meaning of it. But what do we do? Basically, we've been around for about close to 3 months right now. 360 companies are part of it. 1.3 million and counting rapid test kits that have arrived. About 150 to 200 private sector companies are right now testing. We have tested 10 LGUs, Manila, Quezon City, Marikina, etc. And we have 40 LGUs that will be tested in the next 2 weeks. So that's what is happening right now. And what we've seen with the private sector and the LGUs, that the infection level in NCR and in the Calabar area is containable. It's minimal. It's nothing alarming. No. What we've seen also is there's quite a number of asymptomatic people that had the virus. No. So our proposal really is to test both asymptomatic and symptomatic.
Secretary Joy, tell us about because what you decided to do in the very beginning was to use precisely anti-rapid antibody rapid test kits. But now, for example, in this you have this newest project with the PCMC, Philippine Children's Medical Center, and the Philippine Society of Pathologists. Ang ginagamit nyo dito ngayon are the RT-PCR, correct?
Yes, yes. Okay. Again, let me repeat. Testing is very important. It creates visibility. We're now opening the economy more and more, so we have to test more and more. So on top of the rapid test that is happening right now, we have the Philippine Society of Pathology is initiating this research. No, basically, and we are funding the research of the Philippine Society of Pathology, headed by Dr. Robert Padua. No? And we have the Philippine Medical Center, headed by Dr. Lichones, who will be implementing the research, no? The second part of the research. So what is the first part of the research all about? We are going to see whether we can put 5 samples, 5, 10, or 20 samples in one test kit. The principle behind pool testing is assuming you have, like, let's say the testing capacity of the Philippines today is 30,000, assuming 30,000 per day. And the research will determine whether 5 samples or 5 people, 10 or 20 can be placed in a test kit. What is the level of accuracy? So we pinpoints that the level of accuracy is good for between 5 and 10. So with 30,000 capacity a day, under a pool testing times 10, that's you can do about 300,000 a day. No? So how does that work? In one automatic extraction, there, depending on the Sanchon brand, it's about 96 notches, so 96 test kits. Let's just round it to 100. So that 100, assuming you have 10 samples per test kit, that's about 1,000. And I've explained this before. Now, if one test kit is positive, then you have to test all the samples in that test kit. But we're assuming that the level of prevalence is below 2%. No? So the pool testing will work in the Philippines. I was told by the doctors it should not go higher than 5%.
Sec Joy, did I understand it correctly? You're saying that one test, because before ang pagkaintindi natin, one test kit will be used for one person, right? So
That's
now you're
right,
saying
that's right.
5 to 10
So,
samples, meaning 5 to 10 different people. Has this been
yes.
done
So
in any other part of the world?
this is being done in Korea, in China, in Germany, in many parts of the world. And both the Philippine Society of Pathology, the Philippine Medical Association, Dr. Santiago fully supports it. And DOH is open to the idea. In fact, this is really a race to do this research. Now, so we have signed up last Thursday. We had a press conference. And it's a good idea because one, testing will be more affordable because you will be able to use less test kits. Of course, you will have to use more swabs, no, and that doesn't cost much. Number two, you automatically increase the capacity, so you can use PCR pool testing in tandem with rapid test kits as well, no. So what we're providing the private sector and of course the LGUs and eventually the government is the protocol on pool testing. No, I think not only that it brings down the cost because you can test more and you use less test kits. It's the speed, no? It's the speed as well, no? So it's like initially per test kit, assuming 10 comes out in the research that a sample size can be used per test kit, then that's a fairly good number. So 1,000 employees is only 100 test kits, and automatically rather than have 96 samples at one go, you have automatically close to 960 samples now. But of course, if the test kit is positive, then you have to test all 10 of them, no? But that is fine, no? Because we don't expect all test kits to be positive.
All right. Well, Secretary Joey Concepcion speaking for Project ARC. Thank you very much for joining us this evening. You're watching Just the Facts. From response to recovery. We have many questions about COVID-19, and so does the man responsible for investigating and prosecuting government officials. Ombudsman Samuel Martinez wants to question the Health Secretary and his deputies on how they have so far handled the pandemic. More after the break, right here on CNN Philippines. Welcome back to Just the Facts. From response to recovery. I'm Pia Hontiveros. We're glad you could join us today. Over the past few months, there's been a bit of back and forth on the performance of the Health Secretary. Senators have questioned Health Secretary Francisco Duque's handling of the COVID-19 pandemic and even asked him to step down. The Private Hospitals Association of the Philippines also wrote a recommendation to the president asking him to replace Duque because of delays in the release of financial aid to hospitals hit by the COVID-19 crisis, as well as medical frontliners who have either died or were infected by the disease. But the president has stood behind Duque. Let's listen to what the president said on May 26.
Huwag ka masyadong touchy sa issues because always there will be pro and cons. Pakinggan na lang natin because this is a democracy.
But this week, we heard from Ombudsman Samuel Martinez. He has two teams investigating alleged irregularities and anomalies committed by DOH officials. Today, he issued subpoenas for documents relevant to the probe. Here's part of what he told me on Wednesday.
Investigation will start from the secretaries, the undersecretaries, the assistant secretaries, all the directors, or whoever are involved in the purchase of PPEs, in the lapses that had happened in not providing immediately this protective gear to our medical frontliners. Ngayon, kung
Okay, and sir, to clarify, sabi
ulit,
nyo, ang iniimbestigan po ninyo, oo. Okay,
kung
sir, pero sabi po ninyo, Ombudsman, ang iniimbestigan po ninyo, secretary, undersecretary, assistant secretary, directors. And
down the
since
line,
you said, nag-umpisa na po yung, nag-umpisa na po yung investigation. Can you give us an idea kung ano po yung initial findings ninyo? Yes, sir. Yung initial findings po ninyo dito sa investigasyon nyo sa PPE at sa mga test kits halimbawa. Meron na po ba? Can you share some with us?
Mamamatay ba yung provincial doctor ng Laguna, ng Pampanga, kung walang nagpabaya? Will these doctors, these two young doctors, provincial doctors, die? Don't tell me that the ones who were negligent toward these doctors, may their souls rest in peace. Don't tell me that. I mean, they don't see this. I hope they will not tell me that na kasalanan kasi nila, hindi sila naggawa ng protective gear. I have seen in pictures
Naku, ang hirap naman kung ganun ang sagot.
Doctors, doctors na kinakat yung, alam mo yung galon ng tubig, di ba? At ginagawan lang parang face shield. Sa mga government hospitals, maraming mga pictures, mga doctors na
Ombudsman, Ombudsman, yung political background po kasi dito, yung context, is that at one point kasi yung majority senators halimbawa, nag-file pa sila ng resolution, gusto nila mag-resign si Secretary Duque, pero binakapan po siya ni President Duterte. Ang sabi ni Presidente, meron pa raw siyang trust and confidence ng kanyang health secretary. Will the President's support be enough of a defense for Secretary Duque?
Well, the president is also a lawyer. I think sometimes friendship or loyalty ends where your loyalty to your people begins. Diba? Yung iyong samahan, kung minsan natatapos yun. Pag ang responsibilidad mo sa buhay ng iyong mamamayan ay nagsisimula. At ang pinag-uusapan natin dito ay buhay. Hindi ang pinag-uusapan natin dito lang kalusugan. Buhay ang pinag-uusapan dito ng ating mamamayan, hindi kalusugan.
This is very important to ask you, Ombudsman, dahil ang reactions, halimbawa, ng 3 senador, very positive to this development. Ping Lacson, ang sabi po niya, it is about time. Frank Drilon, sabi niya, the Ombudsman intervention should remind our officials to fulfill responsibilities. You cannot escape accountability. Si Bongo, ang sabi niya, all the funds for COVID-19 must be accounted for up to the last centavo. Ano pong masasabi ninyo doon?
I thank Senator Drilon for supporting us, for still believing in us. I promise Senator Lacson magkakaroon ng concrete result itong investigation. I promise Senator Bongo that this investigation will not be limited to the department proper, because even provincial hospitals, regional hospitals, those testing centers identified by the DOH will likewise be investigated. I have my lead on why I want these provincial hospitals, regional hospitals be investigated.
Joining me this time is Dr. Tony Leachon, who until earlier this week was an advisor to the national government's COVID-19 task force. Good evening, Dr. Leachon. Thank you very much for joining us tonight.
Thank you very much, Pia. Magandang gabi sa'yo.
Well, Dr. Leachon, let's begin with that. No, we were just listening to what Ombudsman Samuel Martires had said. He had very choice words for the health department today. The subpoenas, he said this morning that they would be sending the subpoenas to the health department and the budget department, but we couldn't get any confirmation kung nakarating na nga sa dalawang departamento na yan. But first, I wanted to ask you about this ombudsman investigation. At any point, were you able to speak to Ombudsman Martires about this while you were still advisor to the IATF, or Ombudsman Martires or any of the investigators of the Office of the Ombudsman?
Pia, I don't know Ombudsman Samuel Martires personally. I haven't met him. It just so happened on the day of my termination of my consultancy, just about a few seconds after I posted on Twitter about my termination, I saw the news about the ombudsman filing case on the Department of Health. So that's all about it.
Okay, yeah. Well, that's true. No? Yun ang dalawang malaking storya for that day on Wednesday. Nag-announce ang ombudsman, iimbestigahan nila ang health department, yung response ito sa COVID-19 pandemic. Tapos sabay na nag-resign po kayo. But, there are calls now for one senator calling for Secretary Duque to go on leave, another reiterating his call for Secretary Duque to resign. What do you think? You were advisor to the IATF. You saw how the DOH, up close and personal, you saw how the DOH worked in this pandemic. Should Secretary Duque go on leave, resign, or stay put?
Well, matagal ko nang sinasabi, Pia, yan in several interviews, no. The last time, I think, I thought that perhaps it's difficult to change horses in midstream. That was my first position about 2 weeks ago. And then I was interviewed. Perhaps Secretary Duque should actually reflect and recharge and perhaps revisit the plans together with these direct reports and create a guiding coalition with the private sector in order to solve the coronavirus pandemic. Now, my main issue is not actually on the personal level against Secretary Duque. It's about the prioritization of the goals related to the pandemic. So it's about system, and of course there's leadership and governance. But the president trusts Secretary Duque. So what I told in one particular interview is that the answer of Secretary Duque is that he works at the pleasure of the president. Perhaps my other answer is that perhaps Secretary Duque can consider also working at the pleasure of the people by listening to the problem so that they can address it together with the direct reports. So that's my current opinion right now.
Dr. Lechon, yes.
It just so happened that some of my observations and comments which I actually posted Pia sa social media nagkasabay lang nung ombudsman case and basically ito yung mga data
Okay.
management, ito mga lapses and
Yes. Speaking
inefficiency
of
in terms of the delivery of
yes,
services.
right, and including many questions about testing. But Dr. Lechon, just very recently, was it yesterday or today, you posted we should not tolerate mediocrity. We should demand accountability. Who exactly is mediocre? Who that we should hold accountable? Um, Kasi yung ang hirap kasing lahatin
Yeah,
sila, no?
yeah.
Sino po yung tinutukoy niyo
No,
doon na mediocre?
well, I think it's about the leadership kasi um, perhaps it's a pent-up emotion and I'd like to apologize for that comment, but it's a candid comment that because I've been there for 3 months and I've been harping on the generation of real time and granular data. And sometimes, aside from being an NTF advisor, you're also a Filipino citizen thinking about pagka hindi naayos yung real time and granular data, a lot of decision and a lot of people will actually suffer. A lot of people will be pushed into the brink of poverty and
Right,
hunger.
right. Okay.
So sa akin yung social impact
Okay.
nito as well as the loss of human lives.
Okay. Dr. Lechon, huling tanong na lang po, no? And I need to ask you this. Congresswoman Janet Garino, who used to be Health Secretary, released a statement today. She had very strong choice words for you as well. A few of them, sabi niya, unless may pangarap na posisyon, she also said that as IATF, NTF advisor, you were in the best position to intervene and to do something, pero bakit hindi ginawa? And then she also said, and pardon me for saying this, I'm just reading her statement. She said, kay Dr. Lechon, shut up na, tumulong na lang kayo. At sabi niya, huwag gamitin ang pandemya para isulong ang personal na interes. There's a lot of implying here that what you were after is the position of health secretary.
Categorically, laging sinasabi ni Congressman Garinian. Ngayon sasabihin ko po sa inyo, wala po akong hangad ho sa posisyon na yan. Kahit i-offer po sa akin, po yan, hindi ko po tatanggapin ang Secretary of Health position. Matagal na po akong health reform advocate. Mahigit na 10 taon. Nagtrabaho po tayo sa seed tax lobbying. Kahit sinong presidente, alcohol tax, dengue issue, universal healthcare. Yan po ang aking buhay. Pangalawa, maganda po buhay ko. Ako po ay isang cardiologist na nagtatrabaho. I have a good family. Masaya po ako doon. Kaya naman po ako so yun ang una kong sagot kung natanong niya kung gusto ko po yung position. Hindi po. Gusto ko lang sabihin sa inyo, hindi po ako nag-apply dito, Congressman Garin. Ako po ay pinatawag ng Malacanang March 27 gabi ni Senator Bongo. At hindi ko rin kilala si Senator Bongo. Ang sabi ng kanyang undersecretary si Yusek Jenik Ong, gusto ni Senator Bongo tumulong ka at baka may magagawa ka. Nag-report ako, hindi ako nag-apply at hindi ako nag-aspire po. At ang pangalawa naman, bakit tumulong? 3 buwan ko na po yan pinagpapaguran. Andun din si Congressman Janet Garin noong April 20 na nagsalita kami sa Pangulo. At sa haba po ng discussion doon, isa lang ho nasabi ko kasi lahat na sila nakapagsalita. Real-time and granular data po ang kailangan natin, Mr. President, so that we can guide the IATF and the government on the decision-making process.
Yes.
Pero mahigit na po 2 buwan, ganun pa rin ho ang problema. So ano po ang gagawin po ninyo? Ang sinasabi collegiality internal. Kahit po naman ho nang gagalaitin na po ako sa discussion doon, at sabi ko, gawin ito, wala naman pong nakikinig. So, ang point ko ho dyan, alam ko namang risky din ho yun na pagsalita ho doon kasi it's about collegiality. Pero bakit po ang Senate sinasabi po na meron hong failure of leadership siya, mga hospital po? Bakit po doon sa second wave, binaliktad din po
Yeah.
yung opinion na yon? So ang point ko doon, wag naman niyang husgahan na kung may magagawa ko, isa lang akong private citizen. Pangalawa, hindi po ako naghahabol sa social media para makaas ng supporters. Ito po pumutok na lang ho to sa internet, hindi ko naman ho hinahangad to. Pangatlo, hindi naman po ako ang nag-ikot sa mga media station. Ang presidential spokesperson went around media stations. Na-headline nga po ako without me asking for that eh. Yun lang ho ang point ko.
Okay.
Congressman Janet Garin, hindi po ako naghahanap ng posisyon kahit i-offer po sa akin, hindi ko po tatanggapin para ho for the record po. Pangalawa, nagpagod po ako dito hanggang alas 10 ako ng madaling araw nagtatrabaho. Nakita naman niyo po yung comment ng Secretary Anyo na nagtrabaho po ako dyan. Pero there are things na limited na hindi mo magagawa lahat po yun. At ang pangatlo na gusto kong sabihin, hindi po ako naghahanap ng atensyon at hindi rin po ako makikipag-away kahit kanino. Salamat po sa comment nyo at I hope na naintindihan nyo. Di ba nakipagbati na po ako sa inyo? Sana hindi nyo na ho gamitin yon na nagkita ho tayo sa isang hearing sa Senate. Sana igalang na ho nyo na nag-offer po sana ako ng piso sa inyo. Sana tanggapin nyo naman po yun.
All right. Well, this is also unfortunate, Dr. Leachon. I am so sure that everyone wishes all our energies could be focused on battling this pandemic. But anyway, Dr. Tony Leachon, thank you very much for being with us this evening. Salamat po, sir. We want to bring back our Dr. Freddy Gomez. Doc Freddy, as you know, every day we monitor the number of COVID-19 cases, the unfortunate loss of lives, and of course, the number of people who recover from the coronavirus. And that's why testing is important. Today, like we said earlier in the show, and this is what a lot of people are waiting for, you were at a testing facility. Give us an understanding of what happens in a testing laboratory.
Yes, that's right, Pia. San Miguel Corporation has begun testing employees for COVID-19 as part of an extensive plan to reopen its workplaces safely. And swabbing is currently ongoing at their dedicated PCR testing laboratories. Now, we all know that PCR testing is really the gold standard for diagnosing COVID-19 because it is highly accurate in determining whether someone is currently infected with coronavirus. So to give viewers an idea on what happens, first, a healthcare worker will take a swab sample from the back of the patient's nose and throat. Then that swab is stored in a sterile tube and sent to the lab. And in there, trained lab technicians will extract any genetic information from that specimen. So the purified genetic material is then mixed with materials, including some derived from the coronavirus itself. And those are known as the reagents. So the entire solution is then placed into a testing machine. And if a patient's specimen contains coronavirus, then the virus's genetic material will be amplified and the machine will return a positive result. Now, the lab that I went to can render results on around 4,000 specimens in one day. That's a significant number, but what is also notable is the involvement of the private sector in helping the government reach its goals on testing. And hopefully other conglomerates can join in this fight as well. Yeah?
All right, very interesting, Doc Freddy, and thank you for that. Gives us an understanding of what really happens inside the testing laboratory. No miracles here. It's very painstaking work. Thank you very much, Dr. Freddy Gomez. Now, you're watching Just the Facts from Response to Recovery. As we slowly reopen businesses, many are still wondering what the new normal will be like. We'll take a closer look. Stay with us. Many will say there's nothing normal about the new normal, but we need to move on because our lives cannot be on hold forever. Joining us today, Ranjit Rai, Assistant Professor at the Department of Political Science at the University of the Philippines, and Guido David, a Professor at the Institute of Mathematics, also in UP. Good to have you back. Well, I was just speaking to you last night, but good to have you back here on CNN Philippines, Professor Rai and Professor David. Professor David, let's begin with you. Last night, I was asking you about yung inyong projection, no, for June 30, and if it was possible na could it go down or could it go beyond that? But at the same time today, we were, well, a bit surprised or not surprised. No, we have 661 new cases today, 460 fresh cases, 201 late cases. Is this something that we should be alarmed about? Because, it looks like the cases are still going up. Why are they still going up?
Yes. Hi. Good evening. Yes. The cases are still going up. We've seen that pattern since we moved to MECQ and to GCQ. In fact, we also track the number of positive test results. And yesterday, it was the first time we hit 1,000 positive tests in one day. So there are many factors for the increase. One factor is we have, I think, 1,200 OFWs who have tested positive. So they're part of the database. So this adds to the number. The increased testing has increased the number of positive cases. And also, I think the increased mobility has helped or has enabled an increase in the number of new cases. By the way, I think my colleague Professor Ranjit Rai is on mute, so just so he knows.
Yes, but Professor David, also your forecast is 40,000, hindi ba? By June 30, and June 30 is just 10, tama ba? 11 days away. Are we? And I know it sounds fun. Are we on track to hit that 40,000, or are there ways so that we can, not hit 40,000? Posible pa ba yun?
Actually, we're on track right now for about 35,000. I think it was projected a week after we made our projections by the other UP group, UP COVID-19 pandemic response team. At the time we made the projection, the reproduction number was still a little higher. Since then, it has gone down a little bit. So that has reduced the projections. But it would be on track for about 35, 36,000. Hopefully, it doesn't.
Yes.
If it reaches 40,000, then it's not a good sign, actually.
Mm-hmm. Professor Rai, let's talk about what is it that we can do so that we hindi tayo umabot sa 35,000 or sa 40,000. We need to, even if not all the cases are critical, and many of them are mild, and some of them asymptomatic. No, of course we're not comfortable when we have that huge a number, right? What is it that we can do, not just government but us as frontliners?
I'd like to emphasize, and we talked last night, and yes, and you had many guests who were talking about all these strategies earlier, and it's true. Your title is response to recovery, and I guess the answer to your question is number one: we need adequate and timely response, urgent response actually, over the next 2 to 3 weeks. And while Guido and I are hoping it won't reach 40, right now, if you put the backlog together, plus the cases that are already on the list, that's 26 and possibly around 5 to 8,000. We're already at 35 at the moment, and so we have a week left. It's likely to hit. Where we're hoping it won't hit 40, but it's going to go over 35. That's definite. And what we can do. Government is, it's challenged at the moment. And when you look at all the ombudsman cases, there's so much distraction from what we need to do, which is to intensify, test, trace and treat. And that's what we can do. Our government has to work on it. Has test and trace improved? Yes, to a great extent, it has improved. When you look at the long view, which is last March, that's not so long, by the way. But when you look at other countries, when you look at what we still need to do, there's still a lot of work. We need to go up to 15,000 tests a day at least for NCR, no? And then we need to go up to around 2,000 or 2,500 tracers here. We're barely reaching those levels as far as NCR is concerned, no? And we need a whole lot more, a whole army for the whole country. So if you don't have appropriate, timely response, your recovery will, as your title would say, your recovery will to a great extent be hampered. And that's why while we are saying that these numbers are huge, they are still manageable, and we need an appropriate response from government. What we can do in the end, ultimately, in my view, what we do as individuals, okay, as citizens, is more important than anything government does as a response to the COVID pandemic.
Right.
If we agree that we're frontliners, we need to do something about it, and that's physical distancing, that's wearing of appropriate protective equipment like masks, and that's personal hygiene. We need to really take that to heart, because moving forward, as we reopen, as frontliners, we're now, together with government and the private sector, civil society has to do its share in fighting COVID-19.
Right. So like you were saying, we each of one of us is a frontliner, so that we can move from response to recovery. We all have a responsibility for this. Professor Ranjit Rai and Professor Guido David, many thanks for joining us this evening. And thank you for watching Just the Facts, from response to recovery. Stay safe, everyone, and remember, we are all in this together. It's about making choices in our day-to-day lives that promote the common good. I'm Pia Hontiveros.